Uh, Hello, everybody. Good morning, and thanks for coming to the February Survivorship Lecture Series. Today, we have a very special speaker, Betty Roggenkamp, who has made significant contributions to the field of cancer care quality improvement with a focus on the adolescent and young adult population, or AYA. She is an AYA program development strategist at Teen Cancer America, where she works with and across pediatric and adult cancer treatment sites throughout the country to develop comprehensive AYA programs that address the unique needs and challenges faced by this population. She also disseminates research, tools, and resources to help providers better serve this patient population and build upon existing knowledge and expertise, improving the delivery of care to and the lived lives of adolescents and young adults with cancer. So, Betty, go ahead. You should have sharing capabilities. If you don't, let me just make
I
sure.
do.
Well,
All right. And you can see my slides.
yes.
Excellent. Well, thank you, Debbie. And I also want to say thank you for inviting me to do this. Because as I had said probably before a few of you hopped on, I don't recognize very many names on this Zoom. And to me, this is talking outside the AYA space. And so that is a huge plus. And you'll know why as I
Yeah.
present.
Betty, real quick, do you want to go in presenter mode?
I
Or
do not. And I'm going to explain why.
okay, sounds good. I was checking.
I get it. So I was thinking about what I wanted to title this, and I came across AYA Comprehensive because we talk about comprehensive care in the cancer space as being the gold standard. And when we talk about a population and we talk about need in that population of people who are diagnosed with cancer, it's important that we talk comprehensively about the population, and that includes those of you who care for them. And what I want out of this next hour is three things. And I'm going to have to look at my notes on this because I wanted this to come across really clear. One, I want you to take something from this discussion today that you can apply to your practice, maybe even this afternoon, to improve the care that you offer young people who are diagnosed with cancer. Two, I want to learn from you. I want to learn from you what it is you need in order to care for this population. And in order to do that, we have to have a discussion. I really want this to be an interactive presentation. I need your participation because I do work at a national level and I do work for both patients and providers. If we're going to improve, if we're going to work towards improving patient outcomes, we also have to work for providers because we know you are overburdened with the systems that we all work in, that you work in specifically, and we can't ask you to do more. So I need to know what it is you need and want and understand or don't understand in order to prove the space for both. So I don't care if you turn on your cameras or not, but I really, 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 or you can even respond in the chat, but I do need some input here because I need a better understanding. And I know some of you might be in clinic and you can't turn on your cameras. So let's start. I need to know from you, what is an AYA in 2025? And that can be a definition, that can be what it is to you, that could be what it is to your system. But I'm really curious, what is an AYA to you? Anybody?
I can talk.
Thanks,
Can you guys
Andrea.
hear me? All right. So, my name is Andrea. I work at Northwestern. I'm the AY navigator. And so I would say that one of the things, especially that I really tried, so in our institution, it's ages 15 to 39. And we go across the Children's Hospital here, which is Lurie Children's, as well as Northwestern. So that's like the definition from our institution. However, like so when I'm doing outreach, I am doing outreach to people under, 40. However, if my patients age, meaning which we all do, and they turn 40, they don't lose me, So to me, an AYA is so we have, there's a stipulation from my institution that per our program, I can do outreach to those diagnosed before 40, but they don't lose me just because they turn 40. So that still impacts my day to day. And so for me, it's just, that crucial time period where needs are high, not that they're not high in other, age groups, but there are significant topics that are extremely high need issues um, between, when they're diagnosed before 40. But my resources do not go away. And so, like, even the other day, there was like an urgent need grant that came out from Leukemia Lymphoma Society for 40 and above. I literally went through all of my records to see which of my patients had now turned 40 so that I could let them know about it, those kind of things, to try to make sure that they're still getting whatever it is that they need, even though they've aged out of the AYA diagnosis group, but they're still in this crucial time period with all these different high needs. That was a lot. Sorry.
That was great. That was great. And I love hearing that LLS recognizes urgent need. That was fantastic. I see over here in the chat, if anybody else wants to speak, please, by all means. But I'm going to say in the chat, we've got Jessica, who is a nurse practitioner for the Childhood Cancer Survivor Clinic at UI, AYA 15 to 39 question mark. I love that. Young adult cancer survivor, young as defined by the survivor. That's really great too. Peds Hemonc in Peoria. So for me, do not usually see greater than 26, but know the definition is higher, but have unique needs compared to my younger patients. These are great. There is a lot of conversation in the AYA space that I work in on the term adolescent and young adult. And there's also a new term, not a new term, but it's gaining popularity, is this early onset. So by definition, the National Cancer Institute puts AYAs at 15 to 39 at diagnosis. But the word adolescent, does anybody use that other than the medical field, maybe the education field? John Q. Public isn't really familiar with that word adolescent. So just something to think about. We often call them just young adults because John Q. Public does understand that. But I've also heard a 35-year-old say, I'm not a young adult. Some institutions say that their AYAs are people who are diagnosed as children, but are now between the ages of 15 and 39. That works as well. There's that early onset that I've already talked about. Young people. Young people is also another term that gets used, excuse me, in place of young adult. Aging out of AYA, which Andrea just talked about. That's huge too. And I like to say when I talk with AYAs, you don't ever age out of being an AYA. Once diagnosed as an AYA, you are always an AYA. And that's pertinent to their care through the rest of their life. So like, I want them to walk into a doctor at the age of 65 and say, I'm an AYA, I was diagnosed at this age, et cetera, et cetera, et cetera. Because being diagnosed at 35 is completely different than being diagnosed at 55. So that's why I always say once an AYA, always an AYA. Where did AYA start? Back in 2006, there was this progress review group that was brought together by the NIH. And they discovered in that 5-year survivorship measurement mark that those 15, starting at 15 to 19, up through 35 through 39, were not surviving cancer as the other ages were that are younger and low and higher. So that's where AYA started. It was actually in survivor, not surviving cancer, is where this population was pulled out as, wait, who are these people and why are they different? And I will say that we have come a far way with cancer treatment, right? We have really done amazing things. More and more people are living with cancer, living past cancer. And so I really need to get another piece of data that shows how many people are living, but we do know this population still is not at the level as children and older adults. And a lot of that probably has to do to a variety of reasons. One of them being a lot of people, including clinicians, do not think of cancer at this age. So often people are showing up with late stage disease. So does anybody have any idea what the number of AYAs are diagnosed in the United States each year right now? Anybody have any ideas? Want to come off mute? 90 million. I love that. It feels like 90 million to me when I'm working in this space. Lauren, 90,000. 90,000 is the general number that definitely gets used a lot in this space. Oh, before I reveal that number, I really do want to ask this question. Are you seeing more AYAs in your practice? Anybody in the chat even throw it in there? I'm very curious because I got to tell you, I talk with sites across the country. I usually talk with 2 or 3 a week. There's a yes. Almost everybody I talk to says they are seeing more. I actually talked with a site this week, that between 2023 and 2024, on the adult side, they had an 18% increase in the numbers of diagnosed. That's shocking. Not sure, haven't tracked. And I get that. Some of the sites that I work with, we have, when we're consulting with them at the beginning, we have them pull numbers on a 12-month period of those that are newly diagnosed. And often that is when a site starts to see those numbers and they look at them and they're shocked to see exactly how many AYAs they do have. But according to SEER, to get a hard number with some hard facts, 84,100 is the SEER estimate for 2024. Incidence rate. The incidence rate is going up in this population in a shocking fashion. It's so high that John Q. Public's media is picking up on this. The Wall Street Journal, this is this month's Time Magazine featured article, CNN, NPR. I don't think I can go more than about 10 days without seeing a public point of view on the cancer incidence going up. And it's the only population where it is today. It's even being written about in pieces that aren't literature backed, just in opinion pieces within medical journals. It's even showing up now on cancer treatment websites, cancer treatment site websites. But in publications, in medical journals, it's everywhere. I collect these. I have a huge file with a variety that are patient facing, that are public facing, that are types of published literature like this. I did not put links in here on these, but if anybody has any interest in this collection, I'd be happy to send that to you. And I just wanted to show you up close one of these graphs because this is telling the story. This is information that's taken out of the National Cancer Institute's SEER data again. And you can see this blue line, that's the 15 to 39. And if you look at starting in 1975 and going up to, it looks like probably about 2020, it is climbing. And it is the only one that is climbing. And it's just not looking good. Now I want to talk about what defines a survivor, because this too is a conversation around naming a population. Does anybody want to give me what defines a survivor, their ideas or their definition of what a survivor is?
Well, NCI says anyone diagnosed. Period. Go.
And Andrew's got that too. Yep. That diagnosis, very individual thought.
Yes,
Um, it is an individual thought for those who are diagnosed. Many young people have strong opinions about what surviving cancer is. And I don't have an answer for that. I just want to just recognize, and I love that very individual thought. And see, this is why I keep, um, sorry, this is why I keep my PowerPoints in working mode because I like to add to it as I go because this is how I learn and this is how because you're going to get copies of this, right, Deb? You want these slides? Then you can see. I try to type in notes and things that are said so that you can see then what was actually shared from the actual participants too. Anyone who's been diagnosed or treated in my mind, but I think the patient
yeah,
gets to define. I love that. I think the patient gets to define. Yes.
true. Not
Right. Right.
all
It's
survivors say
very,
they're survivors at the same time either. Like there's different time points. It's not a black and white.
it is not. Let's see. What else have I got under the blue box? But when does one seek survivorship care? Now we're talking about the AYA population. Where should they seek their primary care? What's important for AYAs to know in survivorship? How do you tell a young adult that cancer is forever? And does your institution provide documentation of the treatment plan? These are big, big questions that are so relative to this population. They are young. 84 to 86% of them make it to that 5-year mark. Many of them live for decades. They need so much information and understanding about what that's going to mean, that cancer has changed their life going forward. But we don't really know how to explain that to them, when to explain that to them, and to not scare them. I can tell you that I have heard from so many adolescent and young adults that nobody told me I was going to have cardiac issues. Nobody told me I could get a second cancer. Nobody told me X, Y, and Z. They could have been told, but maybe they were told at a time when they couldn't comprehend. Maybe they were told at a time that they were too stressed out to listen. Maybe they weren't told. And I'm not looking for answers here because we can't answer some of these questions. But I want you to know that these are the things that when you are a young adult and you're diagnosed with cancer, what you have to deal with for the rest of your life. And where we as a system and we as providers could make it better for them. And I'm going to touch on these points as we go through the rest of the presentation. So there are 2.1 million AYA survivors in this country. That is a huge population of people that need true survivorship guided healthcare for the rest of their lives. But who are AYAs? Why are they a unique population? Why do so many of us in the AYA space give it our all to improve the care of this population? This slide, it's got a lot. And I just, Deb, will you point anything out in the chat that I need to? Yes, because I do love the interaction. So please keep throwing things out there. And Deb, if you could be the facilitator of that, that would be great. Stop me when I'm on a roll. So who are AYAs? We already established the SEER age, the definition by NCI, but they could be in school, they could be early in their career, they could be early in their family, they could be later in their life, they could be towards 39 and taking care of their parents. They could be single, they could be in a relationship, they could be at the end of a relationship. Their social life is huge at a young age. This is when you're developing who you are, the people that you want to be with. It's just, and then we can add social media to this, right? Social media has really changed this landscape for good and maybe not so good. Social media allows them to stay connected to their friends, but it also reveals the lives of their friends and their family members going on with their life while they're dealing with cancer. Financial impact is gigantic. At this age, they probably don't have a lot of financial reserves. They may not have savings. There's probably a multiple loans involved at this time in your life. The big thing is that when somebody is diagnosed young, they're possibly coming into this cancer naive, healthcare system naive, and health insurance naive. Cancer is complicated. Cancer takes time, and they may not be aware of how much time it's going to take for them to get through their treatment. It's going to take away from their jobs, take away from their families, take away from their education. They may not understand health insurance language. It gets really complicated really fast when you're surrounded by a multitude, an onslaught of bills coming, and you don't know where your deductible is. You don't know what your max out of pocket is. I can't even imagine not understanding that while undergoing cancer treatment. And then the cancer system. Our systems are very, very complicated. It's great when a site can put appointments back to back, but often that's impossible for you to do. That's part of the system. There's also in and out of network. That's part of our system. If a person is referred somewhere while under cancer treatment, and then later they find out that that provider is out of their network, it's almost too much. The mental health, it's so, so crucial that when you're at these busy times of life, when you're dealing with cancer, that mental health is part of the comprehensive care. And things can definitely change in a young adult's life from diagnosis to treatment to surveillance, early survivorship, and late survivorship. Financial well-being can change between diagnosis and treatment. Though support, who your support systems are, can change between treatment and surveillance. These people are young, they can move around. It's just endless what can happen to somebody. Do they have children? Do they want children? That has to be addressed sometimes within 24 hours, maybe even shorter if somebody's coming in with an acute leukemia or lymphoma. These are big, big questions that if you're 65 or you're 5, you're not dealing with. It's also part of the lifestyle where sometimes more riskier behaviors are happening at this time. I could just keep picking from this slide, but what I want to point out of these two quotes here, one, the upper right, is the how do we get the message to young adults that they should seek care if something feels off? If not for his mom, Tyler would have kept soldiering on. I want to talk about Tyler. Tyler's a college student who didn't feel well and didn't feel well for quite some time, went to the university healthcare system, who then sent them immediately to a local hospital in their university town, who then told them that they needed to come to Chicago to a cancer treatment center. And within 24 hours of being admitted to that hospital was confirmed they had cancer, and he had to make a choice about fertility preservation. This was Friday afternoon. Had to make that choice on Friday afternoon because treatment started on Monday. This person is going to be 21 years old next week. I can't even fathom what that family is going through, much less him. Was a college student and then is a person being treated for cancer. And then this comes from actually Andrea, who's on the call this morning, because her and I were talking back and forth about the needs, the financial needs, because cancer is absolutely devastating financially. And she says, I have all the psychosocial support and peer support, yet so much of their stress is related to their treatment, their time, and lack of monies. Because we know cancer takes up so much time. And when you are young and you are either in an education or early in a career or even mid-career, taking that time away from life is devastating. I also want to talk about another Tyler who was having stomach issues again and for quite some time, several months, and presented to the ER. And the ER diagnosed them as having gallbladder issues and wanted to perform surgery the next day. But this particular individual spoke up for themselves and said, wait a minute, I want to take a deep breath and make sure that that's what's going on, and sought out a second opinion. As it turns out, it wasn't his gallbladder. It was stage 3 kidney cancer. And this is a 34-year-old. So that's part of that AYA aware. We're not used to seeing illness such as kidney cancer, stage 3, in people this age. And then Ariel, she's diagnosed, she's in her 30s, she's young and in the height of her building her career, diagnosed with triple negative breast cancer, is an only child, has a parent who doesn't speak English, and is navigating the system right now under those conditions. And then Kimber was diagnosed with stage 3 breast cancer while pregnant with her 3rd child. And Rob was having excruciating back pain. And I see this little, somehow there's some red coming on my screen here. Sorry. Rob was having excruciating back pain and was initially thought to be kidney stones. As it turned out, it was stage 4 cholangiocarcinoma. So I'm just giving you some real life AYA stories of what happens to them, how they enter into the system, and where they are when cancer hits. And the last thing I'll leave you with here is think about your own life between the ages of 15 and 39. And if you were diagnosed with cancer, what would that have done to you? This is from a study that was put out in 2015, I think, 2014, 2015. These are the disruptions. And this particular wheel, this image gets used a lot in the AYA space because it is extremely relative. These are the points that get interrupted when it comes to being diagnosed with cancer: self-esteem, body image, emotions, trust in health, career and education, financial, family dynamics, future plans, because it's kind of scary to think about your future when your body failed you, fertility, your peer relations. There's this term called ghosting in the AYA space. So many people lose friends that they thought they would have forever, but cancer makes people uncomfortable, especially at a young age when people aren't even aware that cancer happens. So they lose a lot of their friends. But often, if they get connected to other AYAs, they gain some really spectacular friends. Health behaviors are questioned. People don't know, like, did I do something that caused my cancer? Or can I do something to improve my life now that I have been diagnosed with cancer? And self-esteem. It's rough when you've been diagnosed with cancer. And you know what? I'm going to throw this. This is why I put these links. I'm going to throw this in the chat so that hopefully that works. Does that work? It doesn't look like that works. Can you link on that?
There is a link that posted as well as the.
It did work.
Yeah, looks like.
Okay, cool. 9:32. I got to go fast. So I want you to become AYA aware. And one of the best places to do that is on social media. There are thousands of them out there. I go to these 2 accounts to just read. You can hear what young people are going through today, like within the last hour. Chelsea Gomez is Oh, You're So Tough. You can see these followers here. If you're not familiar with them, she has 34,000 followers. She's an illustrator and she makes these beautiful illustrations that call out what an AYA experience is. I'm going to throw this one in the chat. And then the cancer patient is another one. This one has 112,000 followers. They can be snarky, they can be on point, they can be absolute excellent places to not only learn about what AYAs are going through, but to learn their language because they have their own language. And I'll tell you what, you can really hit it off with a young person if you're speaking their language. I also want to give a shout out to the CSPN. Teen Cancer America is working with CSPN to do coffee talks across the whole year. Again, this is an opportunity for those of us who are in the AYA space to talk outside of the AYA space so that we can hopefully help build your tools and your resources and your understanding. And actually next week on March 4th, Stephanie from Young Adult Survivors United is coming to talk about her organization and her experience of being an AYA herself. There are many AYA, I shouldn't say that. There are AYA organizations out there that I have discovered through these coffee talks that a lot of clinicians do not know exist. They're going to be in this presentation here today. I really feel like I would be more than happy to put together links to a lot of these orgs after this. Debbie, maybe I'll add that to this slide deck so that people can actually click on some of these and find some of these organizations in case they don't know that they exist. But if you're not a member of the CSPN, it is free and there is a plethora of resources for those who care for those diagnosed with cancer out there. And if you want to learn more about AYAs, join us once a month for these AYA coffee talks there. These are two provider-faced AYA-aware AYA education platforms. The full picture of AYA is a collaboration between Cactus Cancer and Leukemia and Lymphoma Society. Actually, I think you can get credit, still social workers can still get credit by taking this particular course. I think it is 6 recordings. And I got to tell you, if you've got any time at all, and if you want to get a really good in-depth picture from some specialists and experts in the field, I highly recommend looking into that particular platform. And then Elephants and Tea, and I'm saying Cactus Cancer and Elephants and Tea, they are two of the biggest AYA patient advocacy orgs out there, if you're not familiar with them. And they have unique names. Elephants and Tea has AYAO Power, and this is a once a month provider resource and education that is really focused on AYA 101, but then it gets more in depth. What they realized is that there is a whole layer of medical professionals who do not get any education, formal education on this population. And they have pulled together AYA experts, including clinicians and researchers and people who work in AYA programs. And they provide these platforms once a month. They are recorded, they are free, and they are available. So let's put that in the chat. Now, I also want to share GabFest with you because there are many AYA offerings where they can actually connect. And Young Adult Cancer GabFest happens in December. It is put on by Cactus Cancer Society and Elephants and Tea, and it is 1 week long for about 2 hours every night. And hundreds of AYAs participate. And I encourage providers to participate as well. It's done via Zoom, obviously. Because again, if you read the chat, of course, the presentations are fantastic, but if you read the chat, you can really get a pulse for what they're experiencing. And I have learned so much there. But the next slide I'm going to show you is actually from this past year. I took a screenshot because the question was asked of them, during my cancer experience, I have felt, and this is the word cloud. This again can give you an idea of what cancer is like as a young adult. Overwhelmed, frustrated. There's one that says supported, which feels great. Alone. Alone is huge in this population. Heartbroken, lost, uncomfortable, peaceful, motivated, a unicorn, which I think is great, exhausted, dread, horrified, joyful, depressed, frustrated. It's really calls out, and you can tell by the size of the word how many people. If the word is bigger, that means more people actually put that into this word cloud. So again, I would love to hear from you. What's it? It's 9:38. What are your AYA's unmet need? What is it that you don't have access to that you think your AYAs could benefit from? If there'd be anybody be willing to share that, that would be huge because that informs the work that I do at a national level. And I know Andrea had shared with me this morning financial resources. Um, that is so imperative for this population. Has anybody got anything they want to express that they are in need of?
Childcare.
Childcare. Indeed.
Yeah, especially with the sudden diagnosis. I talked to a patient the other day, had two kids, and she collapsed, right? It's,
I can't even imagine how scary that would be.
Dina,
Psychotherapists
like
with
the
knowledge. Ooh.
yeah, psychotherapists. Yeah, absolutely. Navigators would be huge for all types of cancer, but ones that are in tune to AYA needs.
And Dina, if you, are you in the Chicagoland area? Can you say yes or no to that? Because I do have a list of psychotherapists in the Chicagoland area who are AYA aware, primary care doctors that understand that is huge. Oakland area. Sorry.
Mhm.
Send
You are one.
me that list for Chicagoland. Okay. Eddie list of. Okay, so if I do this and if I highlight this in yellow, this will call my attention to come back to it and include that list with this presentation. Oh, and you're creating a list for LLS. Okay, Dana, you're going to get that list so at least you can see what we have here in Chicago, and that might inform a search in other areas. Um, Thank you for those. These are very, very, very key components to the unmet need, which is vast. Let's skip over that right now. So I quickly want to talk about me and where I am, and I'm going to do this uber quick. I was part of the Coleman Supportive Oncology Collaboratives for many, many years here in Chicago. And we started out with an adult collaborative, then we did a PEDS collaborative, and then everybody in the PEDS was like, wait a minute, we need to do this for AYA. It started in 2019. I led that collaborative. It was Advocate Northwestern, Rush, and U Chicago. And I do want to call out from UI Health as Zida Stewart. She was also part of this, and I know she is retired now, but she was a huge mentor to me from a social work point of view in that social work patient interaction. I learned a lot from her. She really was a huge add. But this collaborative kicked off. It kicked off in January of 2020, right before COVID, which COVID was a good thing because prior to this, any of the collaboratives that we had done work in supportive oncology here, we had to do any tools and resources on an 8.5 by 11 sheet of paper because we needed it to be so that it was easily reproducible. But when COVID came, nobody was seeing patients in person, or the in-person interaction was greatly reduced, and it gave us permission to produce resources that could be sent electronically. So I'm going to talk about that first. So we developed a huge amount of resources that were AYA focused. Right here, primary care provider's role in AYA cancer. If you got your phone handy, you can grab this particular patient handout right now. It is a 2-pager. It's not going to give you the primary care providers that you're looking for, but it's going to give an AYA guidance on how to find first of all, the importance of a primary care provider in their life going forward as somebody diagnosed young. And it's going to give them guidance on how to find the one that might see them for being somebody diagnosed young. And that digital aspect, you can grab this through this QR code. We created a lot of resources that were designed vertically because we know most young people access information on their phones. Probably a lot of people my age even do now. And so this tool looks funny on this slide, but on a phone, you can scroll and use your finger to tap on the links. And this was a credible cancer information resource. We thought we'd put together some resources like the NCI and American Cancer Society and COG and different disease types and some of these AYA facing orgs. We actually had one AYA say in a focus group when we were able to put some of these tools in front of them that this kind of a tool would have kept them from scrolling, doom scrolling in the middle of the night to places that they probably shouldn't have gone. So that was really nice to hear. There are varieties of these resources that we developed, and one of them is being a self-advocate, which is really, really important for this population. And I can include a link to that. But what's really important about that self-advocate is out of that collaboration grew AYA's Take Chicago. And if you're not familiar with this event, it happens the first week of April. It is citywide and it is available to any of your AYAs. It is an evening of celebration of AYA awareness. We provide dinner and drinks and great music, and there are a plethora of these organizations down here who will be there, who will offer, information and one-on-one conversations with those who are attending. People can bring their +1, their +2, +3. And this year, like I said, it's about self-advocacy. It is going to be, I think, a really great night where people are going to walk away learning, because one of the keynote speakers is Matt Zachary, and he is the OG AYA. He is the person who started Stupid Cancer, which was the first AYA patient advocacy org. And he is all about self-advocating. We have to teach this population that they need to speak up because our systems are not in their favor. They're mobile, they're young, and their EHR is probably not going to move with them. So there'll be more information on this. It's actually Thursday, April 3rd, which is almost a month away. And if you have any questions about this, please don't hesitate to reach out. Now let's talk Teen Cancer America, because that's where I work today. So Teen Cancer America works in the AYA space. And this is our definition of an AYA program, that they are developed in collaboration between pediatric and medical oncology. They coordinate and build upon existing services and resources to holistically address the unique needs of adolescents and young adults who have been diagnosed with cancer, educate and support the providers caring for them. This is a crude map of the sites that we have partnered with. What we do is we consult with any site across Ped and Med who has interest in building an AYA program. We have a 13-part strategy process that takes them through the building. And then once they get through that strategy, they're eligible to apply for one of our grants. And what our grants do is we typically fund roles. We fund navigators, program coordinators, program managers for a year, mostly like 2 to 3 years. And we also set up the site to have longevity in the role. We don't want this to be an AYA project. We want this to be an AYA program. So we're actually providing seed money to get AYA focused care in a cancer treatment site. So this is one way of showing what an AYA program, an AYA focused care can do. First of all, they can come through pediatrics or they can come through medical oncology, but there's that weird space, let's say like in a sarcoma diagnosis or even a CNS diagnosis, that they could be treated on the medical side or the pediatric side if they're coming in at the age of 18, 19, 20 in their lower 20s. So it's really important that they get to the right hospital for the right care. And I can't imagine being a 25-year-old treated in a pediatric environment That would be the first question that they would be like, what am I doing here? And so that's where that AYA awareness needs to step in to say the treatment protocols, the treatment plans on our side are the ones that you need for the best outcome. Vice versa, medical oncology. I know of a 15-year-old with colorectal cancer right now being treated in the adult side. And that oncologist said to me, I don't know how to talk to a 15-year-old. So this is why we try to get medical oncology and pediatric oncology to work together, especially when it comes to clinical trials too, right? COG is doing a really good job of expanding some of their trials into that adult space because of this AYA population. So the more that peds and med work together, the better it's going to be for this population. So what you ideally want is you want them to be considered for clinical trials. You want them to have fertility consultation right away. Every AYA diagnosed with cancer deserves a fertility conversation, no matter if the treatment is going to be toxic to their fertility or not, because the psychosocial aspects, the stress, the anxiety that comes with cancer can also affect their abilities to have children. And so can some of the long-term chronic medications that a female may need to be on, maybe even a male. We don't know too much about some of these targeted and immunotherapies that are being used. They are keeping people alive, which is fantastic, but we don't know the late and long term. So they deserve to have that conversation. I can tell you about 50% of the AYAs I talked to say they had no idea that cancer might affect their ability to have children. It's great if they can be put into palliative care from the beginning, because palliative care doctors understand the treatment, the diagnosis, the existential crisis, communication. If you've got a palliative care team, it would be great for AYAs to be sent there to have just even one appointment with them. Sexual health is huge with this population, and I cannot believe I'm down to 10 minutes. It is just imperative that they get that comprehensive care from as many people as possible, or at least from as many resources as possible as they go through treatment and then into survivorship. When we talk to sites, we talk about these components being part of what an AYA comprehensive program should be, which are loosely based on the NCCN AYA supportive care guidelines, so that age-appropriate care, clinical trials if they are indicated that they need to be on one. Again, often they present at a later stage. Fertility counseling and preservation, sexual health, key. I know it's uncomfortable for some providers to talk about it, but they really, really, really want help there. Health insurance, financial counseling, we touched on that. Education, occupational help, because it's a total interruption to those. Cycle support, resources for life. Survivorship and transitional information and care. And that transitional information can be from pediatric to an adult teen. It can be from not having cancer to having cancer. And then that huge transition shift from on primary treatment to off, which is an extremely scary point for any person who is diagnosed with cancer. Palliative care, end of life care. This is an AYA needs assessment that is called NASB for short. It is AYA focused, and the reason why the word draft is on here is because this has been recently modified and is being, what am I, not sampled out, I can't think of the right word right now, at the University of Utah. And so there will be more information on this. If anybody is interested in AYA focused needs assessment, I have a collection of those, and I would be happy to send those out as well. These are the NCCN AYA Oncology Supportive Care Guidelines. If you don't know that they are out there, they are incredible. I encourage you to go grab them. ASCO also has a short set of AYA guidelines that hit the high points here: fertility, genetic testing, clinical trials, psychosocial issues, and survivorship. Also, speaking of ASCO, this is the first time for the ASCO annual meeting that ASCO is calling out adolescent and young adults as a population. And they did it on the abstract submission. They put a checkbox there for anybody to check if their submission is AYA related. This is huge. I am on the ASCO AYA Communities of Practice. And what we are trying to do is to get more and more recognition by ASCO, and especially in the adult oncology realm, this population. So I really hope we tried to get that message out. I have heard that people have submitted more abstracts this year. I really hope they have, because this population deserves its day on stage at that particular annual gathering. And this is that AYA's community of practice that's with ASCO. If you are an ASCO member and have interest in AYAs, please, please, please join. We actually have a meeting tomorrow where we're going to be discussing somehow creating a hub out there on the internet where all AYA resources, organizations, information can be found. This is a small sampling of AYA-focused organizations that you may or may not be familiar with. When we talk about connecting AYAs, and I did see that over there in the chat, that is of importance. It is huge. There are so many virtual ways to connect AYAs now. And one of the ones that's local and has a huge data bank is Immerman Angels. They're local here in Chicago, but that's where somebody can be connected one-on-one to somebody who is like them. I can tell you, I've been in enough cancer waiting rooms to know that it's very rare that there's somebody young in there. And so when an AYA is in there and they're looking at everybody else around them and nobody looks like them, that has got to be so incredibly isolating. And we know when they do get connected, whether it's in GabFest, whether it's through Immerman Angels, whether it's through Cactus Cancer Society and one of their art workshops that they offer online, they feel heard and they feel as though they don't have to explain themselves, and it is hugely beneficial. So please take advantage of these organizations. Everything they offer is free. What we know about AYAs is that they probably aren't going to find these organizations by Googling, but if you can offer some method to connect them to the organization, that is a huge way that you can help them. And I know connecting them is not easy. Sometimes communicating with AYAs, communicating with any patient isn't easy. But I have ideas on that, and I will put links to all of these also available for you to use. How much time have I got now? 4 minutes. Okay, I'm going to talk on the high points. Fertility preservation. It is gigantic. It needs to be talked about. They deserve. I just discovered this yesterday in an ACS, American Cancer Society AYA Echo program. This is a tool where you can calculate the fertility toxicity risk. I didn't even know this existed. So I definitely want to make sure that you guys have this tool. The Oncofertility Consortium out of Michigan State. These are oncofertility decision tools that are provider facing. There are so many of them listed there. I really encourage you to investigate this whole organization or this consortium. So much information on fertility preservation. Sex. Nobody's really comfortable talking about, well, I take that back. Very few clinicians are comfortable talking about sex, but it is really important to this population. I will share with you this video. This was done by Teen Cancer America through our monthly drip. This is a sexual therapist, Sage Bolt, and this is an AYA, and this was how she would conduct a sexual health appointment with a young person who's having issues, and it was brilliant. You'll get the link to that. And it just might help you, give you some confidence to have some material in which to talk about sex. There are so many resources out there for cancer patients. And I just want to call out this organization because their information from a design standpoint is very AYA friendly. And I got to tell you, AYAs are digital natives. They have a high acuity for content and how things look. So it's really important that when you are sharing resources with them, that there isn't a picture of an 80-year-old or a 5-year-old on the front page because they won't look any further. I will make sure you get all of these resources as well. Survivorship care plans. Very few organizations offer them on the adult side, but with 85% of them living to that 5-year mark and for decades on, they need minimally documentation of that treatment so that they and their providers know going forward what to look for. You can't mitigate any potential long-term effects if you don't know they're going to happen. Financial issues, because cancer is so expensive. And we can go into that for days, but we don't have time. AYA stories. These 3 published stories will really give you a picture of what it's like to be an adolescent. Just by the titles, The Unique Hell of Getting Cancer as a Young Adult. Patient is otherwise healthy, talks about the troubles and barriers that one experiences going into adulthood. And cancer's robbed me of my fertility and my Olympic dreams. Lastly, I want to give you some AYA isms. These are some things that I've heard AYA say. For people who don't know anything about cancer, they call them cancer muggles. They really don't like battle language because they say they didn't choose this fight. So they don't want to talk about it as their responsibility to fight it. Ghosting is real. I touched on that already. So many of them lose their relationships with their people because of cancer. You will have favorite clothing. I thought was very poignant. It's people, people get used to different clothing that they wear to their infusions and to their appointments, and they wear it time and time again, and that's a safety that they have shared time and time again. You never told me cancer was forever. Please keep that in mind because cancer is forever for when you are diagnosed young. I'm not grateful. I had a young survivor say that she wasn't grateful that she made it through and she was really struggling with that feeling. And this was in a room that had at least 100 AYAs, and so many of them chimed in and said that they felt the same. And then they felt heard because there were tears all around because people were like, oh my God, I thought I was the only one who didn't feel grateful. There's so much to grieve. They grieve the loss of the life they had before. They grieve the loss of the possibility of not having children. They grieve the loss of a body part. It goes on and on and on. This is a person who had a spot show up where cancer was, and they said that there wasn't any active cancer in their body for over 20 years, and they then had to re-deal with all of that again. And that cancer is forever in one way or many for this population. So I want to thank you all for what you do for these people. And this morning, my sister-in-law, who has stage 4 anal cancer, sent me this text, and I just wanted to share it with you because it was pretty powerful when I received it. She shared it with me because I was really nervous about this presentation, but as you can tell, I'm super passionate, and I really thank you for all your time. And I think that's all I have to offer at this moment. Deb, thank you.
Wow, Betty. I knew this was going to be inspirational and fantastic, and you knocked it out of the park. Um, so thank you for doing what you do for the adolescent and young adult population. It's just it goes so much deeper than any of us ever think about, right?
It does. It does. And like I said, it just dawned on me because I was just interviewed for an article that if if you can just put yourself at these ages with
Yeah.
a cancer diagnosis,
Yeah.
everybody on here knows how complicated it is, and just think about that
Yeah.
when you walk the door to the next appointment with a young person.
Right. When they have just life happening. This
Yeah.
is not your 70-year
Yes.
old with lung cancer, like this is a
Yeah.
completely different population that you have to talk to completely differently.
Yeah.
And thank you for highlighting all of that and giving all these great resources, like Ashanti says, and Sonia, Maggie, everyone has been blown away by your presentation.
I
Um,
will. It's going to take me a little while. Probably I'll have to go through the weekend because I really do want everybody to have these resources. They're
yeah,
there.
that'll be
So
fantastic.
it might take a little while.
They will help folks, and I'm glad so many folks attended today. So, does anyone have any comments or questions? Come off mute. Tamara, I haven't seen you on camera all meeting.
And I will, and I can share my email address too. I am open to people reaching out to me directly.
Right.
I am known in the AYA space as dot to dot. It is my mission to connect people to people, people to
Yeah.
orgs,
This
patients.
this field is so, yeah, so networking driven, right? Because it's so multidisciplinary. And I find that too. And it's not with just within the organization, but outside the organization too. And you were bringing up palliative care. I had a great talk yesterday with the new director of Cancer Health Equity at Wellness House, Sonia Williams. Do you want to come off camera and say something, Sonia, in your history in palliative care?
I don't, is she on? There she is. Yay!
Hi, everyone. Hi. Yes, yesterday was absolutely wonderful. Thank you so much for your talk today. I am blown away. And these are the discussions that we have to have with folks in palliative care heading towards hospice. Really, anytime that a terminal diagnosis has been made, right? And, all of a sudden, is all of these questions that are coming. And so, being the health equity person at Wellness House, I also include in there all of those different social determinants that will exacerbate these feelings, right? And
Yes.
just the placements in life. And so, everyone, regardless of who you are and where you are, deserves resources,
Yeah.
right? We value all people. And so, this talk was just amazing. And so, I hope to work with you again in this way because these are resources that everyone can use.
Yeah.
And again, it's about the conversation. And so I think my next book is going to be about what conversations can happen in every room of the house. Right.
Love that.
And so in the bedroom, I've had people who really was having a hard time transitioning because they wanted to know if their spouse loved them, right? If they still saw them as beautiful. And so the
Yes.
psychosocial dynamics of someone's disease process is at the top of the list. And so anytime that we get to have these conversations with folks, I'm here for it. So please do use me as a resource. Anyone else who is here, I am at Wellness House at the main office in Hinsdale. And I spend time in the Chicagoland area. So please reach out. And again, thank you, Debbie, for this invitation.
Yeah, you will be a great asset. I think palliative care is so underused and understood. I think, a palliative care consult should go to anyone with a serious illness, and all cancer is a serious illness. So
Everyone.
thank you. I
Yeah.
have not met a palliative care provider who isn't.
We're looking to expand that partnership. Sonia and I just talked yesterday. I thought that's a perfect complement to bring in the palliative care service at UI Health, and we can then also pull in Maria Perez, the new navigator social worker at something with the pediatric and AYA team also on this call. Maria, you want to say hi and introduce yourself?
Hi, my name is Maria. As you mentioned, I'm currently at UI Health. I came from Comer, so I used to work at UFC, but it was different specialty. I was working with neurology and urology, and I'm here. And I've been here for 7 months or so.
And what's your role? What's your specific? Can
So
you
peds
tell?
oncology.
Yeah,
Yeah,
but what
but
do you do in pizza oncology? You
so I'm the oncology social worker, but we also I'm the social worker with survivorship clinic. So we do see a lot of AYA
Mm,
patients as well.
absolutely. Definitely. Oh,
fantastic. Great connection to make.
Yeah.
Yeah,
Nice to meet you all.
yeah.
Jessica was connecting us to Jessica Ittners with Pete's survivorship at UIC. So many great people on this call. I do have to run, but if you don't, I can make you the host, Betty.
I need to run as well.
Okay. All
Yeah.
right. Yes,
But
I'm already late for my 10 o'clock. It is. So thank you so,
thank you
so much.
again.
And
Great.
anyone has any questions, obviously, Betty will share her email. I'll send out a recap in a couple weeks once I have all these updates and once I get this recording uploaded to our Survivorship Lecture Series YouTube at UI Cancer Center. So thank you
Thank you
again,
guys. This
Betty.
was great.
You.
Thank you.
You're welcome.
Okay, thanks so much, everyone.
Thanks. Bye.
Have a good day.